Now we'll get to talk about two types of polyps that they used to form in the gastrointestinal tract. So you can have inflammatory polyps, and you can also have hyperplastic polyps. All right, so let's quickly look at these two types of polyps and how they actually form the gastrointestinal tract. So inflammatory polyps and hyperplastic polyps, we say that first of all, they are common benign growths. Okay, they are not cancerous. Okay, so the usually inflammatory ones are usually from chronic injury or inflammation, while the hyperplastic ones, they result from abnormal epithelial regeneration. Okay, so let's quickly look at the inflammatory ones. So they are non-neoplastic forms, and it's due to chronic inflammation that they are there. So you can see them in the colon and the rectum. Okay, and they often seen in inflammatory bowel disease. So pathogenesis results from repeated cycles of mucosal injury and healing. All right, leading to granulation tissues and also fibrous stroma. So histology shows what inflamed granular tissues, mixed inflammatory cells, and distorted glands. So clinical features, usually no symptoms, but sometimes it can rupture and cause some bleeding. Okay, so there's a low risk of it progressing to cancer. Then let's look at the hyperplastic polyps. Those ones are benign epithelial proliferation due to exaggerated mucosal regeneration. Okay, so you can see them in the stomach, you can see them in the colon. They are often linked to what? Chronic gastritis or mucosal injury. So on histology, you see serrated or sawtooth architecture of crypt epithelium, elongated glands with surface maturation. So their size is usually less than 5 millimeters. Okay, no symptoms. All right, so most of the times is when they are just doing endoscopy for other things, that's when they now find them out. So cancer risk is minimal, but if they are larger, if they are more than 1 centimeters, then there's now a higher risk of them actually becoming cancerous.